you want to be healthier, yet you just don't know what to do? All these shows telling you this and that, but nothing seems to work. Well, listen close. Golden State Media Concepts has got something great for you. The Health and Wellness Podcast dedicated to workout trends, healthy eating habits, diet, and everything about healthy living. Join us in our banters as we help you not just live life to the fullest, but live it to the healthiest.
Health and Wellness Podcast, brought to you by the GSMC Podcast Network. I'm your host, Alex. Today, you guys, I found myself wondering about lasers. I want to know what they are, what they do, and how they can be used in health and wellness specifically. So we're going to learn a little bit about that together today. Not gonna lie, part of the reason is because I was considering laser eye surgery, which I think is called LASIK now. So I want to know what was up with that. So we're going to talk about that today, starting with how it is defined by NASA, as I figure they're the experts. And then we'll also talk about laser therapies, including laser eye surgery. So first up, what even is a laser? We normally spell laser in all lowercase now, like we do with the term radar, but those actually stand for much larger phrases, in that they're acronyms. So, what does the acronym LASER stand for now that it's gotten to the point that it's so ingrained in our vernacular that we just say it and spell it in lowercase? I'm not sure how you say something in lowercase letters, but you guys get where I'm coming from. So laser stands for light amplification by stimulated emission of radiation. And it's really just a narrow beam of light that we can use in a lot of different technologies and instruments. So with the laser, it is a different light source from what you're used to with a light bulb or a flashlight. This beam of light is very narrow in comparison, and it's useful for some things you might even use at home. So how does it work? As we've discussed previously, light tends to travel in waves, and the distance between the peaks of that wave is called the wavelength. So that's the distance from one peak to the other. If you draw a squiggly line from left to right, then the peak of one of the squiggles to the next peak in the squiggle is your wavelength. And each color of light has a different corresponding wavelength. Blue light tends to be shorter than red light. So following up on our episode on light earlier in the week, that may be one reason why that blue light is more damaging to your melatonin and the red light is the easier one on it. Sunlight, though, is made up of light with many different wavelengths, as is the light bulb light that we're used to in our homes. And when our eyes view that, we see this mixture of these wavelengths together as white light. And that just goes back to the principles of color theory and how you might think that if you added all of the colors together, it would make black. But instead, scientists have found that if you add all of the colors together, they make white. And that specifically goes for additive colors. When you are doing additive color mixing, like light, all of your colors combined create white. But if you are mixing colors together like in paint in a subtractive process, then all of those colors combined create black. That's because when you are doing subtractive color mixing, like with paint, you're blocking out all of the other colors. But when it comes to the colors with light and additive color mixing, you are really thinking of like a prism. So if you are a big Pink Floyd fan, like my parents were, then you can think of their album Dark Side of the Moon and how it showed all of those colors coming in of the rainbow in one side and then the other side reflecting it out as white light. Lasers are a little bit different though, because they don't naturally occur. They're not something that we see in nature. But we figured out ways to create this type of light artificially. I talk a lot in these podcasts about how we're largely also cultural creatures and no longer just more natural creatures like cats or dogs, who are some of my favorite types of creatures. But we're able to make these things artificially because we are cultural creatures. So lasers are something that humans have produced, and they create a narrow beam of light. And in this narrow beam, all of the light waves have very similar wavelengths. And the laser's light waves tend to travel together with all of their peaks lined up, which is something that we refer to as being in phase. And that is why laser beams tend to be very narrow and very bright, and we can focus them on very small spots to help us out in illustrating where we are in a presentation or to drive our cats crazy. That's why lasers are the way that they are. The laser light tends to stay focused and doesn't spread out much, which is very different from how a flashlight or a light bulb in a lamp or an overhead light in your home might look. But these laser beams can travel very long distances, and they concentrate a ton of energy in a very small area. But we can also use them for lots of things. When I was a kid, lasers were very popular to be put into pens so that your pens would glow when you were using them. I remember I had one pen that was covered in aliens. It was clear, but it also had aliens printed on the outside of it. And when you click the top to activate the pen, it would also go ahead and turn it red from the laser that was in it. And you could detach that part of the pen and shine it on the wall. And I would use that just to drive my cats nuts. We also use them for things like library scanning. I was a child librarian, you guys. I loved every minute of it. And when I was checking books in and out, we used those lasers in there too. I was absolutely fascinated by lasers as a kid. But we've grown in our usage for them as the years have gone on. Now we can even use them to cut through diamonds. We can use them to cut through very thick metal or to assist us in surgeries. We can also use them to record and retrieve information like we do when we use them with barcodes. We use them sometimes to communicate and to carry TV and internet signals. We even have laser printers now. When I was a kid, the concept of a laser printer would have been pretty wild. Inkjet printers were really the thing back then, where you're just kind of thinking about ink being spat at a page. But we have developed laser printers over the years to the point that lasers aren't even considered to be a big deal in our modern lives. And the term laser is no longer capitalized as an acronym. It has become a regular usage word in our vernacular. So we also see them everywhere. They're in barcode scanners and our DVD players, and they can also help us to create parts for computers and other electronics. We also use lasers in different tools that are referred to as spectrometers. And spectrometers help us figure out what things are made of. If you watch NCIS or any of those different types of forensic shows, you may be familiar with some of the characters using spectrometers. Well, that's what they're doing, is they're using lasers to help them figure out what things are made of. So, for example, in the concept of NASA, they've used the Curiosity rover with a laser mounted on it to see what kinds of chemicals are on different rocks in Mars. I think that is super cool, and we're able to check that out from all the way over here on Earth. NASA has used lasers for years, y'all, to study gases in the Earth's atmosphere and to map the surfaces of planets and moons and asteroids. Archaeologists and forensic anthropologists have used them to map the location of bones, and other scientists have measured the distance between the moon and the Earth using lasers. So just by measuring the amount of time it takes for a laser beam to travel to the moon and back, effectively for light to travel to the moon and back, astronomers can tell us how far away these large celestial bodies like the moon are. I think it's really awesome, and we're going to go on a quick break. But when we come back, we're going to talk about some of the ways that these lasers are used for health and wellness. Stay tuned.
Are you looking to learn more about the latest trends from the fitness world? Are you confused by all of the different trends that are out there? The GSMC Fitness Podcast is the place for you. The GSMC Fitness Podcast is the place to come for people of all skill and interest levels. Join us as we explore the latest trends in the fitness world. Does that new exercise really work? Should I try yoga? Whatever your question, chances are good you'll find an answer on the GSMC Fitness Podcast.
What the term laser stands for, and how those light waves are concentrated together. So now we're going to talk about laser therapy. Over the years, we have begun to use lasers for all kinds of medical and wellness interventions. Laser therapies are any type of medical treatments that use that focused beam of light. So lasers are tuned to specific wavelengths. That's how they're able to be focused directly in those small beams, rather than being spread throughout a room to provide illumination, like the lights in your home, or in lamps, or even sunlight. You are able to focus these into being very powerful beams. And because they are so focused, they can become intense enough to cut diamonds or even steel. And in medicine, lasers often allow surgeons to use high levels of precision and make sure that they are reducing the amount of damage that is done to surrounding tissues. So you could take a scalpel, or you could take in a laser. It's just going to really minimize the amount of surface to volume ratio that you are truly impacting. It may seem negligible, but when we're talking about how small these lasers truly are, it is significantly smaller than scalpel blades and other tools. Additionally, if you get laser therapies instead of having these other tools, you may be able to look forward to having less pain and swelling or inflammation, and even less scarring than traditional surgery allows for. Laser therapies do tend to be expensive in many different places though, and they can require some repeated treatments. However, There are so many different types of laser therapy that you should really discuss them with your doctor prior to discounting them completely. As not all of these laser therapies will be expensive, and not all of them may require repeated treatments. You can use laser therapy for everything from shrinking and destroying tumors, including precancerous growths and polyps. It can help relieve symptoms of cancer. It can also remove parts of the body that are damaged, like kidney stones or part of your prostate. It can also be used to repair things in your body, like your vision or a detached retina, or help you with hair loss that is a result of alopecia or even just aging. You can also use it to treat pain. A lot of times it's used to treat back nerve pain. So you can use it for removing things or repairing things or even going ahead and just alleviating pain. They can also be used for sealing and effectively cauterizing wounds. So if you are having surgery, you may need to have your blood vessels sealed to help prevent blood loss, or your nerve endings to reduce pain after surgery, or even your lymph vessels to help reduce swelling and limit the spread of tumor cells. So it can help in folks who have had cancer surgeries to reduce lymphedema as well as metastasis. There are a ton of applications for this. In addition to treating bodies to prevent metastasis and to also reduce swelling associated with cancer surgeries and lymph vessels, it can also be used to treat early stages of some types of cancer. And they can be in different parts of the body, like cervical cancer, vulvar, vaginal, or penile cancers, non-small cell lung cancers, and basal cell skin cancers. So laser therapy in cancer is normally used alongside other treatments. So in addition to laser therapy, you may be also getting surgery, chemo, or radiation. You can also use lasers for cosmetic reasons. They can be used to remove different things from your body dermatologically, like warts or moles or birthmarks or sunspots. They can remove hair, so you can stimulate hair growth for them, and you can also remove hair with them. They're used often to remove tattoos as well, and to lessen the appearance of any blemishes, scars, or wrinkles on your body. My general belief is that it's good to age naturally, but also that you look greatest when you feel like a queen or king or non-binary monarch. So you do what is best for you and what makes you happy following these conversations with your doctor too. If that's something that you want, then go for it, because it's your life. And at the end of the day, my opinion on your life does not matter at all. And everyone as individuals are going to want different things. So if you want to get your hair removed with a laser, do it. That is just as much your right and personal decision as getting LASIK is. Don't let anyone tell you otherwise. So who shouldn't have laser therapy? Well, there are certain surgeries that are considered elective that are performed with lasers. That includes a lot of those skin treatments that we discussed, and even some eye surgeries, since they can also typically be treated with having contacts or wearing glasses, like I do. And some folks also decide that the potential risks kind of might outweigh the benefits for them for different types of surgeries. But that really goes for any surgery that's elective, right? Whether that is breast implants or getting a skin condition adjusted with a laser. It's really up to you and your doctor to weigh those potential risks and the benefits that you individually are seeking from this treatment. Now, there are some types of health or skin conditions that can be aggravated by laser surgeries, so just talk with your doctor about it and see what is right for you. If you're going to get laser surgery for any type of operation, it's always best to talk to your doctor. There are many factors that play into whether it's appropriate or the best choice for you, and that can range from your age and your overall health to your healthcare plan and what it covers, how comfortable you are with perhaps paying out of pocket for it, and just the total cost of laser surgery. So your doctor might recommend different methods depending on where you stand with all of these variables. Also, if you're younger than 18 years old, a lot of folks recommend against getting LASIK eye surgery. They're not saying not ever, just to wait a little bit instead. We're going to go on a quick break, and when we come back, we are going to talk about how to prepare for laser therapy, how it's done, and what some of the different types are. Stay tuned.
Tired of searching the vast jungle of podcasts? Now listen close and hear this out. There's a podcast network that covers just about everything that you've been searching. Hey! The Golden State Media Concepts Podcast Network is here. Nothing less than a podcast bliss with endless hours of podcast coverage. From news, sports, music, fashion, cooking, entertainment, fantasy, football, and so much more. So stop lurking around and go straight out to the Golden State Media Concepts Podcast Network. Guaranteed to fill that podcast itch. Whatever it may be. Visit us at www.gsmcpodcast.com. Follow us on Facebook and Twitter, and download us on iTunes, SoundCloud, and Google Play.
Therapies, including who may not want to have laser therapy and what it is used for in general. Now we're going to talk about how to prepare for it and how it's really done. So first up, if you're going to get laser therapy, you want to make sure that just like any other type of surgery or treatment, that you're going to have adequate time to recover after the operation. You also want to make sure that you have somebody available to take you home following the procedure. You may still be under the influence of medications or anesthesia following it. Think of it kind of like having your wisdom teeth removed. I had the general and the local anesthetic for that, and my mom definitely needed to drive me home because I woke up already crying, or rather I became conscious of the fact I was already talking and crying because I'd apparently asked them for my teeth and they'd already put them in the biohazard / sharps container. And I was just brokenhearted in my misery of also still being under the influence of the anesthesia. So just bleeding all from my mouth and sobbing. It was gross, but really funny in retrospect. So my mom definitely needed to drive me home at that point. And it's recommended that depending on what type of surgery that you're getting or what type of laser therapy, that you have somebody drive you home. You can always talk to your doctor about that too and say, hey, I'm getting, just some moles and stuff removed. I'm not going to need anybody to drive me home, right? Or should I? Is this local anesthetic going to impact my ability to drive depending on where specifically you're getting these moles and stuff removed from? So just run it by them real quick and they should be able to tell you exactly what you may need to consider. You also want to take a few days prior to the surgery to find some precautions. So talk to your doctor beforehand about any medications that you're on that could affect blood clotting. So if you are on blood thinners or anything like that, or types of heart medications, or just cardiovascular meds in general, talk to your doctor about that and ask about drug interactions. Overall, it's always a good idea to ask about any of the medications that you're on, just in case there is something that pops up that you might not otherwise think would be an issue. For example, one of the antidepressants I used to be on stated that I could not eat grapefruit at all while I was on it. Fortunately, I abhor grapefruit, but for someone else that could have been quite problematic. So you want to make sure that there is nothing that you are taking that could cause problems with the laser therapy or any of the medication or outcomes of the surgery. And remember, that always includes supplements of any type, whether they be herbal or vitamin. As we've discussed in previous podcasts, those can also impact how your body reacts to different things, whether that be the uptake of certain hormones or medications into your bloodstream, or whether it is just coming down to weird interactions that might prevent you from getting good quality sleep, or even something as big as not being able to really clot your blood. Some of them can be downright dangerous, not necessarily on their own, but in certain conditions and in certain combinations with other things. So even if it's something like St. John's wort, run it by your doctor if you're going to be changing any medication or undergoing any types of treatments. In laser therapy, the way that the lasers are used is going to vary depending on the type of procedure that you're getting. If it's a tumor that's being treated, then they might use an endoscope to go and direct the laser and look at the tissues inside of your body. An endoscope is a thin, lighted, and flexible tube that's kind of like a really flexible flashlight, more or less, and it's really small. And so they insert that into the body as well to make sure that they can see precisely where the laser is going, which tissues that the laser is impacting, and just really to ensure that it's doing precisely what it needs to do and it's not doing anything that it shouldn't be doing. The endoscope is inserted through an opening in your body, sometimes like your mouth, and then the surgeon can aim that laser and shrink or even totally destroy the tumor. If you're getting a cosmetic procedure, they're often usually applied directly to your skin. So that's for things like getting moles removed, stuff like that. Common types of laser surgeries include LASIK, so that's refractive eye surgery, as well as tooth whitening. That can also be performed with a laser, which is pretty wild to think about. It's almost like power washing your teeth with a laser. Then you can also get cosmetic scars, tattoos, or wrinkles removed, as well as cataracts or tumor removals. You're going to use different lasers for different procedures. For example, carbon dioxide lasers tend to make very shallow cuts, and they're used for superficial cancers like skin cancers. You can also use lasers that are made with argon, and those make shallow cuts, and they can be used to activate light-activated drugs, like photosensitizing drugs is what they're referred to, during photodynamic therapies. That type of cancer treatment combines light with the chemotherapy to kill more cancer cells. Different types of lasers like ND-YAG lasers can also travel along optical filters, and they use them in interstitial thermotherapy using lasers, and that's another type of cancer treatment. You can also use low-level laser therapy, or LLLT, and that is called cold laser therapy. So that uses laser light that is set to wavelengths between 600 and 980 nanometers. And that type of laser is typically used to perform minor surgeries and it also promotes regeneration in the tissues. So really, lasers can giveth and they can taketh away, and I think they are remarkable in that sense. There are programs out there that offer cold laser therapy to help you quit smoking, but there has not been a ton of evidence to support its use for that purpose just yet. There are some risks associated with laser therapy, and the risks for skin therapy are bleeding, infections, scarring, changes in skin color, and pain. The intended effects of your treatment may also not be permanent, so you might need repeated sessions. So think about that like tooth whitening, where you have to sometimes go in for repeated sessions. It's not necessarily permanent. The same thing can go for other types of laser therapies. Some laser surgery is also performed under general anesthesia, and general anesthesia can have its own set of risks. So it's not necessarily just the laser that you have to think about, but also the other medications that are interactive with it or integral to it. That can include things like pneumonia, or being really confused and disoriented after waking up from the operation, like I was after the general anesthesia for getting my wisdom teeth removed. They were impacted, so they had to go ahead and remove them surgically. They were kind of growing sideways and wonky and causing all kinds of problems. So they had to go in there and put me under. And when I woke up, I was confused and crying in a snotty, blubbering, bloody mess. So that's just to do with general anesthesia. That didn't even have lasers involved when they did that surgery on me, about 10 years ago, probably. So that's just something else to think about. There's also the risk of heart attack or even stroke, as we're all individuals and we respond to these treatments differently. We all respond to medication in different ways. Treatments can be expensive and are not necessarily accessible to everyone. There is a socioeconomic barrier or component to laser surgery. So LASIK, for example, can cost anywhere from $600 to $8,000 or more, and that is based on your healthcare plan and the provider or facility you select for your surgery. For the skin therapies associated with lasers, that can be anywhere from $200 to $3,400 in general. That can also vary depending on where you specifically live. We're going to go on another break, and when we come back, we're going to talk about the benefits of laser therapy, what happens afterwards, and we're going to talk a little bit about cold laser therapy. Stay tuned.
The GSMC Life and Happiness Podcast takes you on a journey of exploration. We'll discuss tried and true methods alongside the latest trends of how to best live your life to its fullest and happiest. From psychology to meditation, science to self-help books, the GSMC Life and Happiness Podcast will help you to discover what makes you happy and how you can live life being the best you possible. Download the GSMC Life and Happiness Podcast on iTunes, Stitcher, SoundCloud, Google Play, or anywhere you find podcasts. Just type GSMC in the search bar.
About some of the risks of laser therapies and the different types, as well as how it's performed. Now we're going to talk about some of those benefits and what happens afterwards. So the benefits of laser therapy start with them being more precise than traditional surgical instruments. The cuts tend to be able to be made shorter and shallower, especially if they are those carbon dioxide and argon lasers. They can be much more precise in their movements than scalpels that have much more surface to volume ratio. This means that it can cause less damage to your tissues. These laser operations are also usually shorter than traditional surgery times. You can also typically do them on an outpatient capacity rather than having to be in the hospital overnight. And that can help offset some of the costs as well. If you still have to have general anesthesia, you usually don't need to have it for as long, which can also minimize some of those risks that we discussed that are specifically associated with general anesthesia, like pneumonia or that confusion and disorientation after waking from your operation, and the risks of cardiovascular issues like heart attacks and strokes. Laser operations also tend to allow you to heal more quickly. You can have less of that pain, swelling, and scarring than you might get with traditional surgeries, partly due to the cauterization of those nerves and blood vessels, and also just because it's a lot smaller of an incision. It's less invasive. And when we're talking about it being less invasive, we may be measuring that in microns, but when it comes to the human body, it really does have a meaningful impact. Some of them are even down to nanometers, so that's even smaller. That's super, super tiny, you guys. So that can be very helpful, especially if you're working on something like retina. So in those cases, it's very delicate of an area to work on, and you don't have a lot of wiggle room, both figuratively and literally. So the smaller the laser or your blade, the better off it's going to be. After laser therapy, the recovery is pretty similar to that of typical or traditional surgeries. You'll likely need to rest for the first few days after the operation and be prescribed some over-the-counter pain meds until any discomfort and or swelling have really reduced or completely diminished. After laser therapy, your recovery can really vary based on the type of therapy you received, how much of your body was affected by it, and so on. You also need to make sure you follow your doctor's orders precisely. So if you have laser prostate surgery, you might need to wear a urinary catheter. And no, catheters do not sound like a fun time, but it can be very helpful for urinating right after the surgery. There's a reason that doctors do recommend them. If you received therapy on your skin, especially like a cosmetic basis, you might have some swelling and some itching as it's healing, and perhaps even some rawness or tenderness around that treated area. So your doctor might prescribe or recommend an ointment and maybe even dress up that area with bandages so that it's airtight and watertight. So make sure you ask them about whether you can get that part of your body wet and what you can do to prevent that. It may take a few weeks after the treatment to really start healing up very well, and you're going to want to use probably over-the-counter medications for pain, like those typical NSAIDs, although again, make sure you run that by your doctor in case there's anything else going on with your other medications or supplements that might be problematic. You also want to clean the area regularly with water after your doctor okays it for application of water, and apply ointments. So think about it like getting a tattoo. Some types of ointments may just be straight up petroleum jelly if it is one of those skin therapies. And you can ask your doctor about that. Hey, do I need a medicated one, or can I just use Vaseline for this? You can also use ice packs and try to avoid picking any of those scabs. I know in a world where Dr. Pimple Popper is super popular, pun intended, it is really difficult to fight that urge. It is just natural as creatures to want to pick at that. If you have ever had a cat or a dog or any other type of pet that also gnawed at themselves when there was a problem, we're all just animals, you guys. We are just human animals, and they are non-human animals, but we're animals nonetheless. So it's natural to want to do things like pick at your chicken pox, which is why I have a scar in the middle of my forehead, and to pick at scabs, but resist the urge. Perhaps consider treating yourself if you don't pick at it for a couple hours or the whole day, depending on how strong the urge is for you. Treat yourself and positively reinforce yourself not doing these things. So once that area has gotten overgrown with new skin, then you can use makeup or other types of cosmetics to cover up any noticeable redness if you would like. In general, I just go ahead and sport that sucker around like a badge of honor. And it's really, even when it's things like a pimple. I'm not proud of my pimple per se, but everyone gets them, and I don't see why I should have to be self-conscious about something that everyone else goes through. If you feel weird about it, you can always pull a Meredith Grey and pop a big ol' Hello Kitty Band-Aid across it. My Band-Aids are Shrek, often, or Care Bears, or Spider-Man, just whatever I feel like. We're adults, you guys, but we can still have fun with it. So if you love SpongeBob, get you some SpongeBob Band-Aids and go ahead and cover it up that way with some medicated ointment or something instead of just covering it with makeup and perhaps even making it worse. That is my general recommendation. Be yourself and be so comfortable being yourself that other people around you feel comfortable being themselves and ultimately being human too. But that's just me. If you're more comfortable covering it up with makeup, you live your best life. Just make sure that that skin has totally healed first so that you can cover up that redness safely. We don't want to introduce any makeup into an open wound area, which is also why I try not to cover up pimples in that way. Because when that baby pops, it's going to really be susceptible to being infected or being adversely impacted by non-medicated things that are over top of it, like concealers and foundation, stuff like that. Or if I get it like right above my lip, then my lipstick. So I try to avoid that if I can. But you do you. And just live your best life in the safest way that you can to promote your optimal health and wellness. I'm going to go on a quick break, and when we come back, we're going to talk about cold laser therapy.
Are you tired of the same old news? Are you sick of the seemingly endless political spin and negativity? The GSMC America's Still Beautiful podcast is a weekly news podcast covering all the top positive and uplifting news stories. We cover stories that will inspire, uplift, and remind you of the good in the world. Tune into the Golden State Media Concepts America's Still Beautiful podcast to get all the great and positive news stories of today. Download the GSMC America's Still Beautiful podcast on iTunes, Stitcher, SoundCloud, Google Play, or anywhere you find podcasts. Just type GSMC in the search bar.
Welcome back. Before the break, we were discussing what you should do after your surgery, as well as what really your next few weeks of recovery may look like, depending on which type of laser therapy that you get. Now we're going to talk about cold laser therapy specifically. So cold laser therapy is called that because it has low levels of light. And that low level means it's not enough to heat up your body's tissues. So technically, in comparison with the other types of lasers, it is a cold laser. And it stimulates healing while it's using those low levels of light. Cold laser therapy may also be referred to as low-level laser therapy, LLLT, as we discussed in our last segment, or low power laser therapy, LPLT, or soft laser biostimulation, or photobiomodulation. So if you hear any of those terms, they all just really mean cold laser therapy. It means it's not going to be hot enough to heat up your skin. So how does this work? Well, in cold laser therapy, you will have different wavelengths and outputs of low-level light applied to the targeted area. So whatever the particular issue that you're using it for, it's going to be targeted right to that. Remember, it's a laser, so it's a focused beam of light or focused beams of light. Your body tissue is then going to absorb that light, just like it would for sunlight. And then the red and near-infrared light can cause a reaction, and any damaged cells that respond with a physiological reaction can promote regeneration. So you're applying light to help heal your body. A lot of superficial tissues are treated with wavelengths between 600 and 700 nanometers. For deeper penetration, that'll be 780 to 950 nanometers. So that's very, very small. Although you will feel the device that's delivering the laser touching your skin, the procedure tends to be painless and it's also non-invasive. So definitely outpatient, and there won't be any sound, and you're not going to feel any vibration or any heat. Treatments tend to only take a few minutes. That pretty much sounds like a win-win to me. What can we use cold laser therapy for? So you may have it used in a variety of ways. It's primarily used for tissue repair and to relieve pain and inflammation, but doctors, dentists, physical therapists, and a wide range of other medical professionals may use it in their practices. So first up, minor injuries and sprains. It's fairly common to be used in sports medicine and physical therapy, and that can be for things like ligament sprains, muscle strains, tendinitis, bursitis, tennis elbow, knee pain, neck pain, lower back pain, or pain associated with muscle spasms. It can also be used to reduce swelling and to increase the healing of your joints and your soft tissues. That sounds absolutely amazing. I would love to have my knee pain perhaps treated by a cold laser. Right now, I am just doing regular physical therapy for it and trying to strengthen that joint and the muscles around it. So that helps me quite a bit, especially in those bicycle type movements. But this sounds like a pretty neat way to help relieve some of the pain too. So it would be part prevention in my exercises and also just relieving some of the swelling and promoting some of that healing. I also use a TENS unit for my back pain, but you can also use cold laser therapy instead, or perhaps even in addition to it. Whatever you and your doctor feel is the best treatment plan for you. Dentists also use cold lasers to treat inflammation in your mouth and even to heal ulcers. Other doctors use it to treat inflammation that is associated with autoimmune diseases, like rheumatoid arthritis. You can also use it for other aches and pains, whether they're acute or chronic, and that includes everything from fibromyalgia to carpal tunnel syndrome. It can also be used to rejuvenate your skin. Dermatologists use it to treat problems ranging from acne and acne scars to psoriasis and dermatitis, rashes, burns, vitiligo, and edema, which is just a swelling. And in this case, it would be swelling of the skin. But you can have an edema in other parts of the body too, because it literally means swelling. It's also used to heal wounds that are difficult to heal, like those that are related to diabetes. It's used in acupuncture for folks who are uncomfortable with needles. I think that's a really neat consideration because you're not able to feel it in any way. And it is a lot different to have a beam of light focused at you conceptually than it is to have needles poked into you. Even if you might not really feel those needles because they are so small and thin, it just helps to kind of help you think of it in a different way. And remember, when we reframe the way that we look at life and look at problems, it can totally change our lives. They're looking at potentially using these cold laser therapies in the future to perform a huge range of treatments for different conditions. Anything from traumatic brain injuries to spinal cord injuries, Alzheimer's disease, Parkinson's disease. They're really doing a lot of work out there in medical research to find ways to help people to heal from different types of trauma and injuries and pain that have otherwise been proven to be very difficult or thus far impossible to fully treat. So keep an eye on the research going forward on cold laser therapy. It very well may bring us a lot of hope for many issues that have been deemed to be only eligible for symptom treatment in the past and not treating the primary cause. So laser therapy may very well be a big part of our near future. We're going to go on another break, and when we come back, we're going to talk about the most commonly referred to laser therapy, LASIK. Stay tuned.
GSMC Beauty Tips Podcast gives you advice on everything from hair to fashion to skincare products. We'll talk about the latest trends in makeup, hairstyles, and anti-aging remedies. And we'll cover all of the newest fashion trends. If you have an interest in or questions about the beauty trends that might work best for you, the Golden State Media Concepts Beauty Tips Podcast has got you covered. Download the GSMC Beauty Tips Podcast on iTunes, Stitcher, SoundCloud, Google Play, or anywhere you find podcasts. Just type GSMC in the search bar.
Welcome back. Before the break, we were talking about cold laser therapy and how it can be used for everything from acupuncture to treating pain and injuries, and how future uses may even include treating conditions like Parkinson's disease and spinal cord injuries. Now we're going to talk about LASIK for that eye surgery. LASIK is one of the best known and most commonly performed laser surgeries out there, and I think it's generally the one that folks think of when they first think of laser surgeries. Some people refer to it as laser eye surgeries, but it stands for laser assisted in situ keratomyolysis, and that means the surgical reshaping of your cornea. And that's done to correct a refractive error in your eyesight. LASIK is generally considered to be an alternative to glasses or contact lenses. And when you get LASIK, they go in and use a special type of laser to change the shape of that cornea. And the cornea is that dome-shaped clear tissue that's at the front of your eye, if you're looking at an eye diagram. And that really helps improve your vision. Now, why might a person need this, and what does a normal cornea look like? One that's in a person who has normal vision. Well, in a person who has normal vision, the cornea of their eyes bend or refract light precisely onto the retina at the back of the eye. But if you are nearsighted or farsighted or have astigmatism, then the light is bent incorrectly, and that results in your vision being blurred. So you can get glasses or contact lenses to correct your vision, but reshaping the cornea is really affecting the primary cause of the issue, whereas glasses and contact lenses are more of a symptomatic treatment rather than a causative treatment. I hope that makes sense. So you're getting that necessary refraction change on your actual cornea, and then you don't need to wear these contacts or glasses every day. Now, I do enjoy wearing my glasses, but I've only been wearing them for the past couple of years. So I am not used to having to wear them all the time, and I've never worn contacts. I have considered LASIK just because sometimes I still leave my home without my glasses and have to turn around and come back for them. Because within my home, I can usually see most of the stuff that is around me because my vision is really easy for seeing things up close, just not far away. That's because I am nearsighted. I am able to see the things that are near to me, but not so much for the things that are far away. That's called myopia. If you are farsighted, that is hyperopia. And that's just how my personal vision works. I'm fortunate to not have to wear these glasses all the time. I can get up to pee in the middle of the night without having to put glasses on, but I know a lot of folks in my personal life who do need their glasses for that, or everything is absolutely fuzzy around them. So for a lot of folks, LASIK may be a very good option. And even though I don't need my glasses all of the time, I do really feel a lot more comfortable using them when I'm driving somewhere that I'm not familiar with, just to make sure I can read all of the road signs, even though I'm not legally required to wear glasses while driving. So in that aspect, I've still considered LASIK too. Why might you get LASIK though? That's going to be for nearsightedness, for farsightedness, or astigmatism. But what are the specific issues for each of those? Why could we get the same surgery for different types of vision problems? Well, that's because these all have to do with the cornea shape. So for nearsightedness or myopia, your eyeball tends to be slightly longer than normal, or your cornea curves too sharply, and then the light rays focus in the front of the retina, and you get distant vision blurs. Then you can see objects that are close to you, but not those that are far away. With farsightedness, you have a shorter than average eyeball or cornea, and it's too flat, and that causes the light to be focused behind the retina instead of on it, and that makes your near vision really blurry. With astigmatism, your cornea is curved or flattened unevenly, and that means that you're having trouble seeing near and distant vision. So this all just comes down to the shape of the cornea, and since LASIK is just a reshaping of your cornea, you can treat all three of these issues with LASIK. So that means that my best friend and I could both get LASIK, even though she has astigmatism and I have nearsightedness. And we can't really wear each other's glasses because it's not a one-for-one swap for us. I can see fine further away, so that is not so helpful for me when I'm looking through her glasses farther away. And then when she uses my glasses, she can only see really what is farther away, but it doesn't help her for seeing anything near to her. But with LASIK, it reshapes the cornea to not be too flat or too sharp of a curve or to be uneven. It just puts it back to how it should normally be for normal vision. So I think that that's really cool that there is a single treatment out there offered by lasers to help fix all three of these types of vision problems. If you're considering LASIK, you are probably already someone who wears glasses or contacts, so talk to your eye doctor about whether that might be an option that would work for you. There are also other similar refractive procedures though, and you might want one of those instead. So have your doctor lay out all the options for you. That way you can make a truly informed decision. Now there are risks and complications that are associated with this type of surgery, but they're relatively rare. There are certain side effects of LASIK though, like getting particularly dry eyes and having a temporary vision problem like glare that do tend to be fairly common. But that usually clears up within a few weeks or a few months, and not many people have to consider those as being a long-term problem. Some risks of LASIK include dry eyes, and that's because LASIK surgery can temporarily decrease your tear production, and that may be up to the first 6 months or so after your surgery. Dry eyes can reduce your vision quality, so your doctor might recommend some eye drops for it. Talk to your doctor about the specific eye drops that they recommend. You can also get special super tiny plugs that are put into your tear ducts to prevent your tears from draining away from the surface of your eyes. That sounds so wild to me because that's going to be smaller than the plug for like a nose ring even. So there are tons of options out there. You could get little tiny plugs put into your tear ducts, or you might just get eye drops for it. You could also get glares, halos, and double vision. You might get undercorrected or overcorrected, and that means that you might get too little tissue removed from your cornea or too much. Undercorrections tend to be more common for folks who are nearsighted, like me. And then you might need a second LASIK surgery within a year or so to remove more of that tissue. For overcorrections, that can be a little bit more difficult to fix than an undercorrection, and that's when you get too much tissue removed from your eye. So just like a haircut, it is easier to have it undercorrected and then make it a little bit shorter than it is to cut off a little bit too much because you can't really paste that back on. Now with astigmatism, you can also get this from LASIK. So that is uneven tissue removal, and that might require additional surgery, glasses, or contact lenses. You can also get a regression in which your vision slowly changes back to your original prescription, but that is less common of a complication in LASIK. You can also get some flap problems. So there is a little flap in the front of your eye that is moved during eye surgery, and that can cause complications like getting an infection or excess tears. And then the outermost corneal tissue layer might grow abnormally underneath that flap while you are going through the healing process. Lastly, vision loss or changes can be a result of LASIK. That is very rare, and some folks state that they may not be able to see as clearly or sharply as they previously were able to. So check out the ratings, get you a referral, get a couple of opinions from doctors when you're checking out whom you would like to perform your LASIK eye surgery. If you have autoimmune disorders, weakened immune systems, persistent dry eyes, recent changes in vision due to anything from hormone changes to medications or age, or inflammation of your cornea, etc., then you might want to talk to your doctor about a different type of surgery. Doctors tend to recommend against LASIK if you have conditions such as those. Preparation for LASIK is going to be very similar for other types of laser surgery. Make sure you have somebody to drive you home. Make sure you're not putting creams, makeup, perfume, or lotions on the day before or the day of your surgery. And your doctor might instruct you to clean your eyelashes a little bit more often leading up to the surgery, just to help remove debris and minimize that risk of infection. LASIK normally only takes about 30 minutes or so, and you're normally just lying back in a reclining chair with numbing drops in your eyes. I hope you guys have enjoyed this exploration of laser therapies with me, and that if you're interested, you ask your doctor a little bit more about it, and if any of them may be right for you. Thank you for listening to the GSMC Health and Wellness Podcast, brought to you by the GSMC Podcast Network. I'd like to ask that you please subscribe to the show, and writing a nice review always really helps us. Also, if you could please follow us on Facebook, Twitter, and Instagram, I'd appreciate it. Thank you kindly, and have a good night.
You've been listening to the Golden State Media Concepts Health and Wellness Podcast, part of the Golden State Media Concepts Podcast Network. You can find this show and others like it at www.gsmcpodcast.com. Download our podcast on iTunes, Stitcher, SoundCloud, and Google Play. Just type in GSMC to find all the shows from the Golden State Media Concepts Podcast Network, from movies to music, from sports to entertainment, and even weird news. You can also follow us on Twitter and on Facebook. Thank you, and we hope you have enjoyed today's program.